Hi, everyone. My name is Dr. Georgia Knabb, and I'm excited to present this 1 hour webinar about functional medicine and chiropractic's approach to breast cancer. So thank you. I want to thank NCMIC for being my sponsor today for this presentation. And this is a little bit about me. I have been a presenter with NCMIC and presented throughout the United States for at least, I want to say 8 to 10 years now. And before that, I was a speaker for another company. So I graduated back in 1994. I've been using a combination of functional medicine with chiropractic since almost 20 years ago. I started using functional medicine. I'm now an IFMCP, certified functional medicine. I have a master's degree in functional medicine through the University of Western States. And recently, as of this year, I became certified in Bredesen protocol for dementia, and I'm also MOCA certified as well. So, I think with most of you, you're going to see through your practice, you kind of sometimes it'll evolve, and that's how my practice has been over the last 30, now going into my 32nd year of practice, is that it has evolved, always using chiropractic within my practice, but utilizing nutrition and functional medicine within it as well. So this is my disclaimer for today's talk. And I always start my presentations with this quote from B.J. Palmer: "Where there is no vision, the people perish." We never know how far-reaching something we may think, say, or do today may affect the lives of millions tomorrow. It is better to light one candle than to curse the darkness. And this quote means a lot to me because when I first started really shifting and adding in more functional medicine, it's because I was dealing with asthma with my now 30-year-old son. And just with chiropractic, I just couldn't get a grip on it. And it wasn't until I integrated the functional medicine piece into my practice with him that we were able to get the asthma under control. And then it just propelled from there in terms of how I brought those two together, married them together to make the practice that I am in today. So why? Why am I an expert here today on breast cancer, and how do we integrate breast cancer into a chiropractic practice? And is it safe, right? There's a lot of questions that are out there concerning cancers and chiropractic. So why listen to me? Well, because it's very personal to me. Breast cancer runs in my family. This is a picture of uh, a few of my siblings. I come from a family of 8, 6 girls, 2 boys. And when my mom was 46 and pregnant with my youngest sister, she was diagnosed with breast cancer. So once she had my little sister, then she went through a mastectomy and then was put on tamoxifen for 10 years. So then 15 years later, post her breast cancer, then she was diagnosed with non-Hodgkin's lymphoma, again, went through some chemotherapy. And my mom is now, she will turn 85 next month. And she is on absolutely no medications, and she really is thriving. But beyond that, beyond just my mom, 2 of my sisters have also gone through breast cancer. One of those sisters, it was a little bit different. She was a smoker for 20 years, and we really feel that that's the reason that she developed cancer. She is now thriving and cancer-free. And then my oldest sister, hers was more hormonal. She dealt a lot with endometriosis and hormonal issues, and most recently, within the last 2 years, was diagnosed. Both of them, it was caught early, and both of them are really thriving. Beyond that, it goes back. My grandmother had breast cancer, and I have a number of aunts and cousins that have also dealt with breast cancer. So it really does run in the family, and not just a hormonal related. What I've seen through the family is there's many different underlying reasons or causes for the breast cancer. So this is my mom now. This is a pretty recent picture of my mom. And One of the keys that we have to think about when we're looking at our patients is we have to have a definition of what healthy is. And this is my definition of healthy. My definition of healthy is having vitality until our last breath. And that's what I want for every one of my patients as well. And that's what I express to my patients because we never know when when we're going to pass away. It may be today, it may be 40 years from now. Obviously, my goal is to live and thrive just like my mother is until my 90s. And so, to know that definition of health, we have to know our body and we have to listen to our body. And I really encourage my patients to listen to what their body is telling them. And we have to eat, sleep, and move right for our body. And what's right for one patient isn't necessarily right for another patient. It's really about individuality for each one of our patients. So that goes back to listening to what's right to that patient. And being healthy means knowing numbers. I encourage my patients in my practice that they have labs at least once a year. And for me, that's important to look at those patients' labs and look at them on a yearly basis because I'm looking at trends. And if I see trends happening in a negative way, I want to catch that before it becomes a problem. And that really has to do with their immune markers, with their blood sugar markers, and definitely with their hormone markers. I want to look at those on a yearly basis to make sure we're not trending in a negative path. So you have to encourage the patients. A lot of patients have a financial plan. Do they have a health plan? Do you have a health plan as a doctor? So it's important to have that health plan. And part of that health plan, again, in my opinion, is to know the numbers and to make sure that the patient is living that lifestyle of moving, eating, and sleeping, those basic core caveats, making sure that they're doing those right. So we want to encourage that with each one of our patients. So our goal today is to discuss, I'm going to marry functional medicine and chiropractic role in breast cancer, how this combined approach can really help alleviate pain, discomfort, stiffness caused by medications, chemo, radiation, how we can manage nausea and improve the patient's quality of life no matter what their trajectory is. So if you're not familiar with functional medicine, I do hope you are, but if you're not, my definition of functional medicine is really right here. We want to look at the biochemical individuality of each one of our patients. And what that means is that each one of our patients has a unique genetics and a unique environment. And so we need to treat them as such, knowing that we can't have a patient walk in with breast cancer or 5 patients and treat them all exactly the same. That's just that's not fair to the patient. What we really should do is look at their individual genetics and look at their environment and then look at their labs and say, okay, what's right for this patient? How do I optimize this patient's immune system to help them to have the best outcomes? We also want to look at a dynamic balance, internal and external balance, and understand that there's web-like connections, correct? Just because they've been diagnosed with breast cancer, we still need to look at them as a whole to really treat them ideally. To know that if they're having hormonal imbalances, there might also be some GI issues. There might also be some brain fog that goes with that. And so we want to address all of those aspects to really, again, give vitality and the best outcome for that patient. And understand that health is a positive vitality. Just because there is a diagnosis, such as for breast cancer, that doesn't mean that, oh, if this, then it's all downhill. In my opinion, that when I talk to my patients, everything in life that's worthwhile, it's uphill. And when we're talking about women, it's really uphill, right? So, it's not all downhill. And I never want a patient to think, if this, then there. If we remove the interference, the body has the ability to heal. That is how we're designed. And we've got to look at it in a positive way, always. That mental outlook is essential. We also want to promote organ reserve through looking at, again, that web-like connection and promote optimal physiology for that patient. So this is a patient-centered, root cause and system-oriented approach when we're working with patients. So Sydney Baker has this fascinating paper that was published a number of years ago, but it still applies to today. And when you actually summarize that patient, it comes down to two key questions. Number one, is there something which this patient has an unmet need? And number two, is there something to which this person is intolerant? What I tell patients, the way I say it to patients is there something that needs to come out? And is there something that needs to come in? And if they understand that, that's what we're trying to do. We're trying to figure out when we're looking at these patients from an individual basis and we're evaluating what's their lifestyle, what's their diet, what's their sleep, is there something that needs to come out that they need to change? And are there unmet needs? Are there nutrition? Is there whole food? Is there something that we need to put into their body? And in one sense, it's like I look at the patient, I'm like, well, this is kind of easy for me to say, but sometimes we really have to dig down and it might take a little bit to figure that out. But the key is you're working with the patient to help figure out what needs to go out, what needs to come in to help them to optimize their health. So the key is to understand that we have a shared focus when we're looking at functional medicine and chiropractic. Both of these philosophies, both of these approaches say we need that there is a body self-healing. The body has a self-healing capacity. It really does. It still comes back to what needs to go out, what needs to come in. That we're looking at homeostasis. We're trying to find that optimal balance for that patient. And we're trying to get down to that root cause. Yes, chiropractic focuses on the nervous system, because the nervous system controls every single function within the body. But sometimes there's other things outlying that we need to help look at. And we want to help remove the interference, not just on the immune system, but not just on the nervous system, but on the immune system as well. And we also want to take a whole food approach. And this is where we have Alma Arnold. If you remember Dr. Alma Arnold, we're going to go back over 100 years. Dr. Alma, A-L-M-A, Arnold, was the first female chiropractor. And I believe she wrote a book called The Triangle of Health back in 1895. We have a copy of it upstairs. I didn't include it in my slide, but Dr. Arnold talks about way back then about the triangle of health. And she talks about exactly what we talk about to our patients today. Do they have an optimal nervous system? Is their nervous system working at its optimal? Are they eating whole food? Are they sleeping? And are they moving? And it's really fascinating how, my gosh, over 100 years ago, this was being talked about in the chiropractic community, and we're still talking about it today. What she was talking about marries into the functional medicine and the chiropractic approach. So this whole talk has been going on for well over 100 years. We just got to, encourage our patients to get back to those basics. So when we're dealing with breast cancer and we're looking at that root cause analysis, these are some of the key things that in my practice that I'm going to look at with my patients. So I'm going to definitely look at hormonal imbalances with that patient. If they're in, we're going to run labs or some type of analysis to look at, are they in estrogen dominance? Or do they have the patterns for estrogen dominance? Is there a xenoestrogen exposure? And that means, is there something from their environment where there is estrogen exposures that we need to help the patient remove? And that includes plastics. That definitely with our female patients looks at their makeup and the creams. Because if a patient is on any cream that is an anti-wrinkle, anti-aging, typically those have estrogens that are being put in, because estrogen is what it tightens up that skin. And so we want to encourage the patient to get those out of their environment and not be putting those into on their skins, because those xenoestrogens are going to disrupt their normal healthy patterns and create imbalances within their hormones. Insulin resistance and PCOS. Within insulin resistance, we definitely want to look at that metabolic balance within those patients. And if there is insulin resistance, is there an increased risk for breast cancer? That's really debatable. When I really looked at the NIH, the National Institute of Health, and the research there, it's pretty debatable on whether PCOS, whether there's an increased risk for breast cancer. There's a little bit of research newer from 2024 that I saw that said, yes, there is. Older research says no, but it says there is an increased risk for ovarian and other types of cancer when we have PCOS. I think for me, I'm always looking at how do I optimize my patients' hormones. And when I talk to patients, it's always about we've got to balance those blood sugars. It really is key. And then we look at thyroid, adrenal, and those sex hormones. But anywhere within those hormones, if we have a blood sugar issue, we have to address that to help optimize all of those patient hormones. Because some cancers are metabolically driven. And when it's a metabolically driven type of cancer, that's a blood sugar imbalance, and we have to address that. You know what's fascinating? What I love about the technology today is the continuous glucose monitors that we can use to help, again, individualize what is taking those blood sugars out of balance. And it helps hold the patient accountable. In our office, we use Stello. There's a few others out there. Stello's pretty affordable. What I like about the Stello is that in the container, it has two units, and each unit is a 2-week monitor. The patient, make sure when the patient uses that, it puts it right on the back of that tricep, not kind of on the side. You want it on the back. So if they're sleeping on their side at night, if it's a little bit more on that bicipital area, if they're laying on it, it can interfere with with its signaling to the patient's cell phone. So make sure it's really I tell the patients, my female patients, put it on the wing of that tricep. And what's nice is you don't even know it's there, but it regulates their blood sugars 24/7, and the patient can then see what's taking them out of range. I've had patients where coffee is an issue. Coffee is causing them blood sugar issues. I've had patients that they're doing great through the day, but at night when they're sleeping, their blood sugars are going out of balance. And then we have to analyze, is there a sleep apnea issue? What is going on there so we can balance those blood sugars? So it truly helps to fit into how we individualize that patient's care. And it is a game changer using this unit for my patients. So then what I have patients do is they'll use it for 2 weeks, and we see, okay, what's taking them out of range, and have them work on making dietary changes. And then maybe a month later, I'll have them do it again, because what we can see is, has it dropped their average blood sugars over that time frame? And then we keep working on that. I have not had one negative complaint about using that Stello. It is powerful when we're dealing with metabolic issues such as insulin resistance, prediabetes, and diabetes. That is part of that picture of the breast cancer. And so within this too, within the hormonal imbalance, we have to also look at methylation and detoxification pathways and think about how we can support that. And in a few slides down the road, we're going to talk about some approaches that we can use. We also want to look in terms of root causes at inflammatory markers, and we can look at that through blood labs. But with inflammation, we also goes back to the blood sugars and what is causing that inflammation. And oftentimes blood sugar imbalances are really underlying the inflammation that patient is dealing with. We want to look at toxic load within these patients, and definitely if they're a smoker, that's a huge concern, as I talked about earlier with my sister. And when she got that diagnosis for breast cancer, and she was stage 1, it was caught early, she stopped smoking, and she never looked back. And that has been close to, I believe it's been about 10 years now when she was diagnosed, and she has never picked up a cigarette since. But we know that smoking puts, because of the toxins in there, the cadmium exposure, the detoxification, the methylation interference that smoking causes, We know that smoking puts you at increased risk, and we want those patients, if they are smoking, we want to encourage them and support them in stopping smoking so that we can help support that detoxification pathway. We also want to look at impaired detoxification. There's a number of ways that we can do that. And we want to look at, again, that metabolic dysfunction and help support those. So these are some of the key root causes that I'm going to evaluate with each one of my patients if they're being diagnosed with breast cancer. Now, these are some of the lab tests that I'm going to use in my practice. I'm going to look at blood labs. I'm going to look at their hormone levels, and I do look at the whole hormone pathway, FSH and LH, progesterone, cortisol, DHEA, testosterone, free and total, estradiol, as well as total estrogens, because I want to see what's happening over that whole pathway. I'm going to look at the inflammation markers with this patient. That would include the CRP, sometimes SED rate, homocysteine for sure, because homocysteine is going to tell me about that detoxification. I'm going to look at a GGT, which is our liver detoxification pathway. We're also going to look at metabolic markers. So when I look at metabolic markers and I'm looking at blood sugars, I'm looking at their fasting glucose, their fructosamine, which is their average blood sugar over 3 weeks, insulin, C-peptide, triglycerides, as well as their A1C. And that gives me a short-term and a long-term picture of the blood sugars. It gives me a baseline that oftentimes isn't looked at within the medical arena. Sometimes the only thing they're looking at is the A1C or their fasting glucose. And they're not looking at those intermediate markers within the blood sugar, which are really important markers, especially if there's PCOS history with the patient. We definitely want to understand what is happening with insulin and C-peptide. So those are our key markers there. Our methylation markers definitely are going to be GGT as well as your homocysteine markers. Cancer markers, there are definitely certain cancer markers. Typically, you're going to leave that within the medical. The oncologist is going to be monitoring those. But sometimes the patient is going to ask you, can you check a few of these? If they're a pretty aware patient, I've had patients walk in and say, listen, I want you to check the CA125, the CA19, and I have no problems doing that for the patient. And then we're also going to look at those nutrient markers. Iron is absolutely key to understand, to make sure that the patient iron levels are in a good place. So we want to look at the full iron markers, ferritin as well as TIBC, the saturation, and their serum ferritin as well. So we can understand that whole iron picture. And that's key because the liver, if there is anemia, then the liver is going to have a hard time detoxifying because phase 1 detoxification requires sufficient amounts of iron. And so we need to know that iron, that liver has the nutrients that it needs. Nutrient markers also include those B vitamins, B9, B12. I'll oftentimes also check B6. And then again, we want to look at homocysteine, because if that homocysteine is running a little high, then we've got to wonder if we're deficient in B2, B6, B9, and B12. Sometimes within that, you can check methylmalonic acid to have a better picture of that B12 as well. Vitamin D is absolutely key, and optimal levels for vitamin D in our cancer patients is going to be between 50 and 100. There's some fascinating research. This was actually done on male athletes that showed that optimal levels between 75 and 125 were in a better place. Now, that is male athletes, but I do want to know that those vitamin D levels are sitting north of 50 in my patients with cancer. So those are some of the key nutrients that we look at on serum. Now, what we can also do is we can do saliva. Just understand that saliva is looking at bound versus free. So blood, we're looking at bound, saliva is looking at free hormone. So we can't compare the two. They're giving us good information. What I do like, if I'm dealing with cancer and a patient's wanting a little bit more knowledge about their hormones, is that saliva we can track through the cycle. And that's really nice if a patient is cycling and they're wanting to know what's going on with their hormones. But understand we cannot compare blood and saliva. We're looking at two different pictures, bound versus free. We can also use a Dutch dried urine test for hormone metabolites. This is going to tell you how well those detoxification pathways are happening, which is really important when we're dealing with breast cancer. So Dutch can be extremely helpful when we're supporting a woman with cancer. And then we can also look at stool. And what I love about stool is now we're really understanding how those immune pathways are working. When we're looking at stool, now we can see, does this patient have her keystone bacteria to help support immune function? Akkermansia, Faecobacterium prausnitzii, Bacteroides. Those are our keystone bacteria that are important for that whole immune system to be able to function. What we can also see on stool is beta-glucuronidase. And beta-glucuronidase is a liver enzyme that messes with estrogen. So if beta-glucuronidase is elevated, that means that those estrogens are being put back into her system, because when beta-glucuronidase is high, it's breaking up estrogen, so it's put back into the system, rather than allowing estrogen to be excreted through the stool. So this is a really important marker to check to make sure that detoxification pathways are happening appropriately. I love doing stool on my patients. I use Rupa Health to do the ordering. It allows for you, if you're not familiar with Rupa, RUPA, Rupa is great because it's kind of a central ordering point for a number of different testing companies. And it also, they work with, that you can also order serum labs. So you don't have to have a account with LabCorp or Quest. You can use Rupa as a central ordering platform for your patients, and it really is quite convenient to use and allows you to order any of these tests that I'm talking about here from a central point. So it makes it convenient for you as a practitioner. They also offer a lot of training and support within their system. So it's really nice in that sense. So you can order any one of these and help support your patient within that. What's also nice is then it doesn't allow for you to have to keep these kits on hand, because you can just order it and Rupa sends the kits to the patient directly, and the patient pays Rupa directly as well. So it kind of takes you out of the middle. I love it. It just has really simplified my practice in terms of ordering specialized tests that I need for the patients, again, to help optimize their health on their path. So chiropractic roles. What is chiropractic role when you have a patient come in and they've told you they've been diagnosed with breast cancer? It is tremendous. And this is, my opinion is, I want to be a positive coach for my patient. I want to offer them a very safe environment for them to be able to discuss their concerns and their fears. So just a month ago, I had a patient who's been dealing with PCOS for a number of years. I've worked with her on her metabolic, but still been a struggle. Well, just a month ago, she was diagnosed with early stage breast cancer. And so working with her oncologist, working with her to help mediate some of those fears and her concerns, but still treating her. I still treat her I see her every 2 weeks for the chiropractic, because it's a huge support for her. And I think that we can work well with oncology and be a part of that team and support her. So we want to be a positive coach for the patient and definitely offer them a safe environment. Definitely chiropractic is powerful in terms of helping to reduce any pain, to support their postural function, and to help support lymphatic drainage. Chiropractic is powerful for that. It does help to reduce the stress, and it helps to reduce sympathetic overdrive for those patients. So it helps, again, helps their nervous system to be able to function at its optimal level. It can help to reduce pain medications and other medications that the patients might need. With chiropractic, it helps to support that nerve and immune function. It helps to support their sleep, and you can help them with the chiropractic, it can help support some of their habits that they have to make sure that they're getting good sleep to help optimize their detoxification pathways while they're sleeping. We can also encourage the patient to help make sure that they're moving and that they're getting some type of exercise as well. I want to encourage you that it is safe. Even when there's bone metastasis, the question becomes, should you adjust, right? When there's been metastasis to the bone. And I've got three papers. There's just not a ton out there in terms of chiropractic and cancers, especially when it's metastasized. So you have to decide, you have to work with the oncology unit, and you have to decide with the patient, what type of chiropractic, is it safe? To what extent do you do it? I know in my practice, I adjust my patients when they've been diagnosed with breast cancer because I want to support that immune system as best I can. And it really does benefit the patient. But again, we want to coordinate that. We want to be part of that team and be a positive aspect for that. So this is one paper. This comes out of the Journal of Canadian Chiropractic management of a patient with breast cancer metastasis to the brain and the spinal cord. This is a case study that was done. That chiropractic worked with this patient in a very positive way and improved the quality of life for that patient. And so that's what this summary talks about here, is that the positive aspects of using chiropractic and the benefits of that. This is another study, patients with cancer. Is there a role? This was a panel that discussed the positives and negatives, and it came out very positive in terms of the role of chiropractic in patients with cancer. This is the discussion, and you can go online. These are all open access studies that you can go online and see if you have any concerns or any hesitancy, or if you've just to understand, the power of chiropractic with cancers. And this is another one. This is a very recent one. It came out in 2022. Metastatic recurrent breast cancer was identified in a chiropractic office. So this was a chiropractor that identified it, a case report and a literature review. And this was a chiropractor that found cancer and then continued to treat with the patient with the breast cancer, concurrently with the oncology team as well, to help reduce the pain and improve the patient's quality of life. So I'm sure there are other studies out there. I was trying to limit how much I was showing you, trying to keep it to the most current that we could see, but give you confidence that yes, we can work with a patient with chiropractic in adjusting that patient and helping to improve their quality of life, reducing their pain, improving their sleep, improving their lymphatic flow, and helping that patient emotionally as well, as they work through this. So another aspect to help support the patient, because they're going to come into you, they're going to ask you questions because they see you as the expert oftentimes when it comes to diet and nutrition. And so one of the strategies that I definitely want to encourage you to use with your patients who are going through cancer and they're going through chemotherapy and or radiation is intermittent fasting. Intermittent fasting is powerful when it comes to helping the patient to reduce symptoms of nausea and vomiting that can come when they're going through chemotherapy. One of the key things is that the day before a patient goes into chemo is have them start their fast by 6 o'clock that evening. And then you want to encourage them to fast until about 8 hours post their chemotherapy treatment. And that will significantly reduce their feelings of nausea and any vomiting. You can have them use things like bone broth to help keep them, to help keep nutrients going in while they're receiving the chemo or post in that 8-hour window of having them fast, because bone broth does not break their fast, but it is going to give them some nutrients, and it's very healing and very calming to the GI tract, but it's not going to overwhelm the system. So majority of the time, patients that are having significant amounts of nausea and vomiting is because their body is struggling, if they've eaten, with the food and with the chemo. And there becomes this clash within their body of, what do I deal with? Do I deal with this chemotherapy, this medication that's coming to my body, or do I try and metabolize this food? And it's going to say, I can't metabolize this food, and therefore there's going to be symptoms, and the patient's going to either have a lot of nausea or vomit it out. So we can significantly reduce all of those symptoms. So I encourage you to talk to your patients about fasting. It's when they're going through chemotherapy treatment. Again, have them stop by 6 o'clock the evening before their treatment night, and then 8 hours post-treatment. Making sure they're using bone broth to help keep them hydrated so they don't become dehydrated. The other thing we can encourage outside of that window is make sure that patient is getting sufficient amounts of fiber. The average American is only getting between 10 and 15 grams of fiber per day. The RDA for fiber for women is 28 grams. For men, it's 38 grams a day. We want to encourage both soluble and insoluble fibers because that's going to help bind to if there are hormones and these toxins to help get them out of the system. So encourage that with your patients. There's some great new foods out. If you've not heard of Carbonot, it's a gluten-free, dairy-free, egg-free bread that you can find at Sprouts, but one slice has 15 grams of fiber in it. Most of that is prebiotic fiber, such as inulin. It really is a well-made bread. In my opinion, it's best if you toast it, but then I encourage patients toast it and then put some nut butter and some ground up flaxseed. And that one slice is about 20 grams of fiber. It's nutrient dense. If there's metabolic issues, it's going to help keep their blood sugars very stable. It's a great breakfast for our patients because it's a great way to start the day because it'll keep those blood sugars very, very stable. So that's called Carbonat, Carbonaut. Fantastic as an alternative to help get that high fiber. Another good one for patients is kiwi. And there was a great study done on patients with constipation in kiwi. And the key is they need to eat the kiwi with the skin because that's where all of the fiber really is on the skin of the kiwi. So what I tell patients is when you take your kiwi, wash it off, cut off the two ends, they quarter it and eat the whole kiwi. Fantastic source of fiber. There's lots of other sources of fiber, but those are the great ones that we could use. Now, what about diet strategies? There's some great strategies out there. Whole30, carnivore, paleo. Is there an ideal diet? I don't think there is. I use the diet that's going to work with that patient to help keep their metabolism stable and be as nutrient dense as we can with that patient while they're going through any type of chemotherapy or radiation. Any one of these I think is fantastic. Just tailor it to what the patient's need is and what they can do, making sure you're keeping it as nutrient dense as possible. So this is Prolon is this is a fasting mimicking diet. There's been a little bit of research just now coming out on combining the fasting mimicking diet with chemotherapy, specifically with breast cancer. So this is one of those studies. This is another one from the American Association of Cancer Research on the fasting mimicking diet. If you're not familiar with that, it is called Prolon, Prolon. It comes out of the University of Southern Cal, and there's other research for other things. I want to bring it up to you because because the newer research coming out specifically on breast cancer, and that is our talk here. I have done it, Prolon, I've probably done it at least 12, if not more times myself. It is a 5-day fast, but basically there's a kit for 5 days, and you eat what's in each of the boxes each day, so it's kind of set. And what it does is it doesn't trigger nutrient sensors. So your body thinks it's going into a fast. So you go through the stages of a fast. So by day 3, your body is in fat burning. Day 4, it's in autophagy, which is that deep cellular cleanup. And on day 5, they're showing that the body is going into making new stem cells. It is powerful. I've utilized it successfully in my practice. Patients do love it. Some of the complaints might be some of the soups, but the patient has to, it's only 5 days, and it's to benefit them, and it really can be a great work well when they're going through therapy. So I really encourage you, if you're not familiar with it, look into it and encourage it with your patients. Nutritional support, definitely optimize that vitamin D with your patients. Iron, those omega-3s, they're anti-inflammatory. Ensure your patients utilizing a really good pharmaceutical grade omega-3 that is high on the EPA DHA. I tell my patients, please don't be buying, over the counter in these big box stores, these omegas, because a lot of it is rancid. And it might even contain heavy metals. We just don't know. And sometimes it just says fish oil, and that's just junk. I mean, what I tell patients is it's no different than eating a Twinkie. And really, do we want to eat a Twinkie? No. So let's really optimize and use high quality pharmaceutical grade supplements to help support them at their, with the best thing that we can give them. I tend to stay between 1 and 3 grams a day of the EPA DHA. Again, this is going to depend on the patient, the inflammation, and what we're dealing with. Liver support is absolutely key, especially if you're dealing with estrogen types or hormonal types of cancer with the patient. You can safely use DIM or calcium D-glucarate. If you're not familiar with those, DIM would be like eating your cruciferous vegetables, your Brussels sprouts, your asparagus, broccoli. Those are your food sources of DIM, which support liver detoxification. Calcium D-glucarate is going to be very specific to that beta-glucuronidase enzyme that I mentioned earlier, in that calcium D-glucarate blocks that beta-glucuronidase enzyme, so it allows for us to make sure that those estrogens are being excreted through the stool. These can be used safely with patients and help support that liver detoxification. There's herbs as well that can be used: astragalus, echinacea, cat's claw, burdock. A lot of these are used in other countries. I do use them in my practice. There is studies. In today's talk, we don't have time to really delve into that, but just know those are herbs that can safely be used to help support the patient. These are other herbs that we can use. Curcumin, because it's an NF-kappa modulator. It's also anti-inflammatory. Green tea, so your EGCT. There's lots of research out there on its support there for liver detox. Flaxseed ligands, milk thistle, dandelion, those are going to be your liver support. Reishi and your medicinal mushrooms are powerful immunomodulators. So there's a lot of nutritional support that we can use. Lifestyle and mind-body. I encourage my patients to use vibration plates. The price has really come down. You can get them on Amazon. I don't know if I necessarily have one brand that I recommend to patients. I just want them moving. And those vibration plates are very good for lymphatic movement, which is important when we're supporting a patient with breast cancer. I encourage them to do 10 minutes every day on that vibration plate, and to not just stand there, be moving while they're on that vibration plate, doing squats and all kinds of movement to help support that lymphatic drainage. Encourage them to get lymphatic massage, or they can use a rebounder at home, which is also very good for lymphatic movement. Ensure your patients is getting good sleep. The key question I ask my patients, are they waking up rested? Whether they're getting 5, 6, or 9 hours, I want to know if they're getting up and they're like ready to go and rested. If they're not, I want to figure out how do we get them to where they are waking up rested. There is an app called Sleep Reset. This app stands out because it uses cognitive behavioral therapy to help support good behavioral. It is not free. There is a small cost to it, but some of my patients have found it to be very beneficial. I just had a patient on Tuesday come in saying that she used this and she had been on sleep medication for over 15 years to help her sleep. And this was the one thing that helped her get off of all medications. And she told me her sleep is fantastic now by simply using this app. So it's exciting to me to see that there's technology out there that our patients can use to help optimize their health. We can use, in terms of stress management, chiropractic is fantastic in helping neuromodulation and helping their patients in all aspects of their health. We can also encourage patients to use breath work, yoga, gratitude journaling is also beneficial. I encourage you to help the patient too with their environment, looking at their environment, or at minimum, encourage them to use the environmental working group, their website, or their app called Healthy Living to detoxify their home. Because it's one thing to detoxify the body, we also have to look at their environment to make sure that their environment is safe as well. And that includes water, that includes their air quality, that there's no mold or radon within the home, and the products that they're using. At minimum, have them use your female patients who've been diagnosed with breast cancer, have them use the environmental working group to make sure that their cosmetic products are safe. And again, that they don't contain any xenoestrogens within them. Encourage your patients to use social connections as well. There's quite a few Facebook groups that are out there that they could use to help support them through that healing process. So in summary, is chiropractic safe when we're working with a patient with breast cancer? Absolutely. We work as part of that whole team with that patient, be a positive coach for that patient, encourage them in their nutrition, their movement, and sleep. There's so much that you can do to help support them, but be part of that team. Again, support them however it's appropriate for your practice and for your knowledge base. Support them in healthy hormones, support them in their detoxification pathways, encourage them to move, use a vibration plate, encourage them in having a healthy mental attitude, and nourish them with whole foods. So I want to thank NCMIC from the bottom of my heart for allowing me to be a speaker for them for so many years. It's just been awesome. I love being able to be a spokesperson for chiropractic and for functional medicine. So thank you, and have a very blessed day.